Hello everyone, welcome again on the YouTube channel of CHAMELI DEVI Institute of Pharmacy, INDORE. In this session, we will going to discuss about introduction to daily activities of a clinical pharmacist. These all are the contents of the session, that is definition of clinical pharmacist, goal of clinical pharmacist, that is board round participation, treatment chart review, adverse drug reaction monitoring, drug information and poison information, medication history, and patient counseling. Now, what is clinical pharmacist? So, they participate in direct patient care in hospitals and other healthcare facilities. Clinical pharmacists care for patients in all healthcare settings, but the clinical pharmacy movement initially began inside hospitals and clinics. They often work in collaboration with physicians, nurse practitioners, and other healthcare professionals. As well as clinical pharmacy is a branch of pharmacy in which clinical pharmacists provide direct patient care that optimizes the use of medication and promotes health, wellness, and disease prevention. Goals of clinical pharmacists, that is, their general function is to monitoring history review, offering consultation for drug selection, therapeutic drug monitoring and analysis of body fluids, and patient counseling. A specific function would be detection of adverse drug reaction, preparing and formulating total parenteral nutrition. Special functions is similar to medical specialties. A clinical pharmacist can also be specialized in certain areas of practices. For an example, treatment to the following patient need careful attention and monitoring and specialization, that is, pediatric cases, geriatric cases, psychiatric cases, and drug addiction cases. Some of their functions are mentioned in this slide, that is, board round, clinical research, optimization of therapy, medication history review, patient counseling, prevention and monitoring drug infection, therapeutic drug monitoring, community services, monitoring and reporting adverse drug reactions, clinical review, provision of drug poison information. Now, board round participation. So, board rounds are the routine clinical rounds where the healthcare providers visit the patient in the ward to assess the progress of the health condition of the inpatients. The doctor-led ward rounds comprises of the unit of medicine or any other specialty wherein professor, associate professors, assistant professors, senior residents, postgraduates and intern along with pharmacists and nurses observe the patient's condition and assist to decide further therapeutics for the patient. There are some goals of ward round participation, that is, it is to closely monitor the patient condition and take immediate intervention to improve the patient condition and avoid death. The doctors are visiting all the patients admitted in their unit in an order beginning from intensive care unit. The duties of the pharmacist in ward round is the pharmacist in ward round should take 2 times, one with the doctors and other one with himself alone. In the first ward round, he follows the treatment given and checks the formulary for the dose prescribed. Further, he may also critically think any possible risk to the patient due to drug administered. He will alert the team and prevents the further casualty that would have occurred due to the known viability of clinical pharmacy services. In the second round, the pharmacist targets the patients prior to discharge and advise the patient regarding discharge medication practice. In the rounds, he also motivates to knowledge, diet and exercise required for disease management for a patient to the discharge. Treatment chart review. So it is a fundamental responsibility of a pharmacist to ensure the appropriateness of medication orders. It serves as a starting point for other clinical pharmacy activities, that is medication counseling, therapeutic drug monitoring, drug interaction and adverse drug reactions. Organizing information according to medical problems helps break down a complex situation into its individual parts. Their goal is to optimize the patient drug therapy and prevent or minimize drug-related problems or medication errors. Components of medication order review or treatment chart review. That is to checking that medication order is written in accordance with legal and local requirements, ensuring that the medication order is comprehensible and unambiguous, that appropriate terminology is used and that drug names are not abbreviated. Annotate the chart to provide clarification as required. Detecting order for medication to which the patient may be hypersensitive or intolerant. They are also ensuring that the medication order is appropriate with respect to patient's previous medication order or history, patient's specific consideration, that is disease state or pregnancy time period, drug dose and dosage schedule, especially with respect to age, renal function or liver function, as well as route, dosage form and method of administration. Now, adverse drug reaction monitoring. This is also the very important functions for clinical pharmacists, and they have important responsibility in monitoring the ongoing safety of medications or medicines as part of their professional practices. A drug needs to be considered as a concept with benefit risk profile applied to treat patients through proven or commonly agreed measures where benefits outweigh risk. Here comes the role of pharmacist on a global perspective called pharmacovigilance. Drug information and poisons information. This is the another goal, function or role of clinical pharmacist. So it means providing clinically relevant information on any aspect of drug use relating to individual patients, or general information on how best to use drug for populations. First Drug Information Center was opened in 1962 at the University of Kentucky Medical Center and was intended to be utilized as a source of selected, comprehensive drug information. Poison information is a specialized area of drug information which includes information about the toxic effect of mechanical and pesticides, hazardous materials, household products, overdose of therapeutic medicines including mushrooms, animal toxins from bites or snakes, spiders and other venomous creatures and stings. Now, another one is medication history. So there are some steps of this process. In the first step, they introduce themselves to patient and ask for permission to discuss their home medications. They check each patient's name and date of the birth. Ask whether they come to hospital from their home or facility if you are uncertain. They also ask whether they manage their own medications or if someone helps them. And they ask about the name, strength, dose, route, and frequency of their medications. They also ask about OTC products, vitamins, and any medications taken less often. Also ask about inhalers, injectables, creams or ointments, eye drops, ear drops, nasal spray, patches, and medication samples. They will ask about which pharmacy or pharmacies they use and inquiry about allergies. They thank them and ask whether they have any questions. And they evaluate the medication history obtained against at least one additional sources. Other than that, patient counseling. So, first of all, patient counseling is defined as providing medication information orally or in written form to the patients or their representatives on directions, storage, diet, and lifestyle medications. Their objective is the patient should recognize the importance of medication for his well being. A working relationship and foundation for continuous interaction and consultation should be established. Patient should understanding of strategies to deal with medication side effects and drug interaction should be improved. They should ensure better patient compliance. Thank you everyone for watching this session.